Hi, my name is Kyle Payne. I'm the founder of Mind Free Counseling as well as a licensed associate counselor. And I'm doing this recording of a live webinar I've done in the past for both individuals looking for ketamine assisted psychotherapy, or as I refer to it, KAP, as well as healthcare providers looking for referral sources for their clients looking for these services. So the idea is I'm going to share all the information that I typically share in a live webinar presentation with you, as well as some of the commonly asked questions throughout the presentation. So what can you expect from this recording? We're going to talk about what and how does ketamine work. We'll get into when is KAP a good potential treatment for a client, and then we'll get into the three primary ways in which it's administered, including pros and cons of each. And then lastly, we'll talk about the actual process, what should or should not be part of the actual process, from the setup to each individual session to the length of the protocol to what happens after the client is done with the protocol. So we'll get into all that good stuff. And as I alluded to before, obviously with this being a recording, you won't be able to ask questions live, but I'll try to address the most common ones throughout the recording. And I encourage you to reach out to me via email or a phone call, whatever's convenient for you, with any questions you might have, so we can further answer your questions if I don't address them completely in this video. So that being said, let's get started. So a little bit about me and my personal experience. So I've been working with clients since 2022. I've completed the EMDR certification process. I've also completed 4 advanced EMDR trainings. I bring that up just because there's a lot of EMDR trained therapists, but unfortunately, the majority of them do not go through the certification process, and or they do not do any advanced trainings past the basic training. And I bring that up because it's really important that as an EMDR therapist that they get certified, but also do advanced trainings, because the basic training really doesn't provide much, if any, training for complex trauma. And the reality is that in today's world, most of the time we're dealing with trauma that's got at least some complexity for the client. So that's important to have a therapist that has that understanding, that training. I also did the KAP training through an organization called TRIP, pretty ironic name. It was performed by Dr. Jennifer Montroy down in Tucson. So I bring this up not only to share what my qualifications are, but also to give you a clear idea that I look at working with clients through a trauma lens. Because at the end of the day, when we look at anxiety, depression, PTSD, basically any variety of mental health ailments, the symptoms can typically be rooted in trauma. And so I've made my focus in my training, in my education, to really focus on understanding trauma. And part of that journey has led me to understand something that I think very few people have heard or understand intimately, and that is that traumatic events are only traumatizing when we experience them alone. So it's really important. This is not something that is, to my knowledge, mainstream, but it really resonated with me when I heard this in a workshop. The truth of that. So again, traumatic events are not traumatizing unless they are experienced alone. And this is really important to understand because it ties into why KAP can be such a healing treatment for trauma and ultimately all the symptoms that come out of trauma. So, from my education and viewpoint on this, when we're really small, like age 5 or younger, if we don't have very attuned parents, which is actually most parents, not to say that all parents don't do poorly consistent with this, but it's really hard for parents to be fully attuned, especially if their parents weren't attuned to them when they were a kid. So they have this, the result of dissociation. They can't connect with their inner self. So they can't truly be present and calm. So when we're 0 to 5, we're basically left in a situation where we don't have any rational thought, any sense of self. So we're just kind of stuck in situations sometimes that are very overwhelming, and we're just sitting in a pool of our emotions that can be overwhelming. So, if you imagine a little baby at middle of the night wets their diaper, in that moment, they have no idea what's going on. They just know it's uncomfortable. They don't like this. They want to get rid of this. and they start screaming, and hopefully a parent comes sooner than later to soothe and to take care of that situation so they're not stuck in that. But they have no power. And when we get to about age 5, what happens is that we start to develop an egoic self. And that's something that helps us through these troubling times, something that can come up with strategies to avoid these situations in the future. However, what it ends up doing, and one of the ways it helps us through it, is it brings our awareness out of our body where we feel this overwhelming anxiety or depression or heaviness or whatever you want to, whatever the emotion is. It takes us out of the body into the mind. And in doing that, it helps suppress the physical sensation so it's not so overwhelming, so it becomes part of the solution. But ultimately, it's cutting off access to our deeper self. And the problem is that our egoic self always feels like it's, alone on an island. It's always isolated. So anytime we go into our mind, what happens is we ultimately feel a sense of aloneness, a sense of isolation, a sense of me versus the world. And that's because it creates a duality where there's me and everything else, but I'm not connected to that. I'm separate from that, from the egoic self perspective. So what ends up doing, ironically, is creating an environment internally where anytime an emotion comes up that's overwhelming, we immediately go into thought. We immediately go into our mind, our egoic self. It's me versus this life situation. And what that does is, ironically, it creates a sense of being alone. The irony is that the life situation that our mind thought was so critical to get us away from the feeling, if we just sat with it and we experienced it in our body, not in our mind, we wouldn't feel alone. We'd actually end up feeling a sense of connectedness to ourselves and our surroundings, and it wouldn't end up being traumatizing. The irony is that our mind's solution to bring us away from the overwhelming feeling, because it needed to do that because from 0 to 5, we're just sitting in it, created a responsibility for it to keep us alive, and ends up putting us in a position where just about any life situation can feel traumatizing, can be traumatizing to an extent because we feel alone. So the reason I bring all this up is it ties into why ketamine assisted psychotherapy, or KAP, is helpful for treating trauma. It also highlights how, when we talk later, how a lot of organizations are doing ketamine is missing the mark with this. And this is the most important thing, which is why I make such a big deal about it in this recording, but also my live webinars. So what ketamine assisted psychotherapy essentially does at a high level, we're going to get into more of the science in the next slide, but at a high level, to really understand it, it's a dissociative drug, and it allows our egoic self to kind of dissolve or go into the background. So the mind is not actively seeking to take us out of our internal experience. And so when we get that dissociative experience, it allows us to drop into our body, into our inner self, into the spaciousness within us, our true source of self. And when we do that, we have an experience of a euphoric experience of a connectedness to anything and everything all at once. So it can be often described as, being a drop of water and then dropping into the ocean and realizing you are the ocean. So that euphoric oceanic feeling is what happens. But really, at the heart of what's happening is the thing that's been pulling us away, making us feel isolated, making us feel as if we're broken, as if we need to fix ourselves, that we're alone, it's us against the world. That part of us is being, basically taking a break. It's taking a siesta. And so the result of it going on break is we actually experience a much deeper sense of who we are. And we are that source of energy that is love, is compassion. And in that state, we don't actually have problems. We don't actually have anything about us that needs to be fixed. So the key with KAP and why it helps treat trauma is ultimately it removes the egoic veil that says we are alone, that says we are broken, that says we need to fix ourselves. And we actually realize a sense of truth of who we are on a much, much deeper level. So this dissociation, this removing of the egoic self to feel connected to love, feel connected to everything is the point. And it is why ketamine can help. All right, so let's get into a little bit more of the science, because I'm sure this is exciting to a lot of people. Actually, it's kind of interesting. So what is ketamine exactly and how does it work? So it's a two-part molecule. It's the R-ketamine molecule and the S-ketamine molecule. When I'm speaking about KAP, I'm referring to full ketamine. So it's using both molecules in it. Now I want to take a mini detour. I want to talk about S-ketamine. Also, the brand name of S-ketamine is Spravato. And I want to talk about the differences because it's really, really, really important. So Spravato only uses the S-ketamine molecule, hence the official name S-ketamine. The thing about this is that it only shows dissociation with about 40%-ish of the people who do S-ketamine, aka Spravato. And my suspicion, and the people I've talked to have done this and also done ketamine, like the full, both molecules, both parts, have described if they did have any dissociation, it was much milder. Now, remember what we just talked about. It's the dissociation, meaning the dissolving of the egoic self and feeling into, dropping into your body, feeling into who you really are on an energetic level. That's the key to solving the trauma. So if the S-ketamine or Spravato is not always providing that dissociation, and when it does, it's a much milder version, the issue that I have is that it's not going to lead to that dissociative factor, and then it's not going to actually provide the kind of results that people are looking for. Now, this is fine if the person doing S-ketamine understands this and is told this and understands that this might just be more of along the lines of like a microdosing effect where you're not going to get the dissociative effect. You may, and if you do, it's going to be very mild. It's just going to be helpful in calming your nervous system, which is certainly plausible, but it's not going to really get you deep enough into the root of the solution, which is your inner being. The problem I have with this is that a lot of clinics make a significant amount of money on this. I've heard upwards of $400 a session, and the protocol for this model, for the insurance to pay for it, is 2 sessions for 4 weeks, and then 1 session a week for an additional 4 weeks, so a total of 12 sessions. So clinics are making upwards of almost $5,000, and because insurance does pay for this, and this is the only really consistent thing that they do pay for, ketamine related, it's something that is a big money maker for clinics. So it's not that I wouldn't recommend someone doing this, just go into it knowing what to expect. If all you can afford is S-ketamine because you can't afford to pay out of pocket for KAP services, I get that. I'm not saying not to do it. Just go into it with eyes wide open. Know exactly what it is and keep an open mind to the idea of doing KAP. The reason why I have concerns about this not being disclosed is what happens is clients go in and do this. They're expecting to get fixed, which we're going to talk about that later on when we talk about intentions and how that can be so harmful. And then when it doesn't get the dissociative effect, so it has like very low probability of actually resolving the issue. And eventually when the effects of it wear off, which we're going to talk about in a second, what happens is the client then feels more convinced that they're actually broken because not even S-ketamine worked for me. So that's the drawback. And so that's why it's really important to have clients understand this going into this, so they're not over extending their expectations, something that's not maybe realistic. All right, so enough about S-ketamine Spravato. From here on out, all I'm talking about is the ketamine with both molecules, because that's what you're here for. So how does ketamine work? Well, one of the things it does is it blocks NMDA, which is N-methyl D-aspartate receptors. So think of it this way. When someone has highly anxious, highly depressed, or both, and they're constantly thinking, worrying, having thoughts about how down and their life is and not having hope, those types of things, there's an energetic pattern to that. And it's going to create pathways in the brain, like highways. And if the person is using that a lot, those highways are going to be heavily traveled, and it's going to be the common it's going to be the common place that their thoughts go to. And if someone is looking for ketamine-assisted psychotherapy services, I'm pretty sure they probably fall into that category more than they do. I'm usually really, really happy all the time. Just sometimes I get a little bit frustrated. So what happens when the ketamine starts blocking the NMDA receptors? It blocks the main highways. So all of a sudden, the highway that the glutamate was going, that increases brain cell communication, which is going to allow for more firing of synapses and more information getting transferred. Those highways are blocked, and ultimately what happens is that the glutamate then has to go to other parts of the brain, has to use secondary highways that in many cases for clients are hardly ever used, right? And so these are highways that are going to be more aligned with, actually, maybe I should give myself a break, or life isn't so bad, or, I got some good things going for me, or I can get through this, or like resilience and other things that align more with like love and compassion and not the negative emotions. So it actually starts to increase communication in these parts of the brain, which increases the neuroplasticity, which allows for those highways to really strengthen and become potentially highways that we use on a regular basis. Another thing that it does is it stimulates what's called BDNF, brain-derived neurotrophic factor, also known as brain fertilizer. So these parts, these secondary highways, they haven't been kept up. They're starting to die off. They're starting to fall apart. So the brain neurons in these parts of the brain are atrophying. They need repair. They're not very resilient to sustaining a good connection or staying strong. So the brain fertilizers, like if you had a flower in a flower bed that's starting to wither, if you put fertilizer in that ground, there's a good chance that that flower is going to regrow back. It's going to repair. It's going to be stronger. So if it has a little bit of a drought, it's not going to wither right away again. So that's essentially what ketamine does to help the brain actually rejuvenate and access parts that tie into compassion, peace, calm. And that's why clients describe after doing ketamine feeling much calmer. That they're not getting engaged in, old egoic patterns of thinking, which is the old highways that kind of got shut down by the ketamine. Here's the thing that's really important to note. These effects of ketamine on the brain work for approximately about 30 days. After 30 days, what starts to happen is the brain neurons start to atrophy. The old faithful highways open up again, and all of a sudden the thinking patterns shift back to what they were before. And this is important because if a client goes in with the mentality or even an intention to fix their symptoms, they are going to be disappointed, because ultimately ketamine will not do that, not by itself. And if there's not a lot of thought and consideration towards what to do with this 30-day window of opportunity, it's likely to lead the client in 3, 6, 9, 12 months, whatever it is, however resistant they are to the reality that they're back the way that they were. Eventually, they're going to arrive to that conclusion. And again, it's going to reinforce, I'm broken and there's no hope for the future. And that's going to cause a lot of mental issues for the client. So unfortunately, a lot of times people are having great experiences with ketamine, and that's what the therapist or doctor's hearing, the more immediate results. What they're probably not seeing is in 6 to 12 months, somewhere in that range, they're facing the reality that it didn't work and they're back to normal. They're back to the way that they were before, and it's actually now working against them. So doing this in a way that actually leads to opening up that window for 30 days and then knowing what to do with that window to help them work through the trauma, to actually help them keep those secondary highways of compassion and love open, making those the primary pathways through actual work, is really critical. So when can KAP be beneficial for a client? Honestly, any kind of significant or complex trauma. And like I mentioned earlier, most trauma has some complexity. And you'll know that someone has trauma because they'll have symptoms like depression-like symptoms, especially if the depression is resistant to the other types of medications. If they have anxiety, if they're a constant worrier, if they've had PTSD-like symptoms related to traumatic events earlier in their life. And really, if you think about it, any mental health challenge is going to kind of fall into having at least depression or anxiety-like symptoms for the most part. So any of those situations could be a good sign. If you're a mental health care worker of some sort and you notice clients describing feeling stuck or they just go through a loop or a pattern they can't break, these are also signs of trauma, and it's their egoic mind not willing to surrender and let go of the pattern because they're trying to keep them safe from the trauma that they experienced earlier. So ultimately, those are good indications that this could be helpful as well too. So what are the three main methods for administering ketamine and the pros and cons? So what I'm going to do is I'm going to start with the most extreme, most intense, and work down to the most gentlest approach and talk about the pros and cons of each. So the first method, which is the most intense, is intravenous. So the pro is it's extremely powerful. So for people who have a lot of mental blocks, basically you do the IV and those mental blocks, they just get, the ketamine just plows right through it like it's nothing, like warm butter. So they go right into dissociative state. It's very strong. The other nice thing with the IV is that it's 100% bioavailable. So if you put 25 milligrams into the IV, you're going to get exactly 25 milligrams in the body. You know exactly what you're getting. So what are some of the cons? Well, honestly, one of the cons is way too fast. You're talking about dissociating, meaning all of your mental barriers, all your sense of self are gone in 3 to 5 seconds typically. And the reason why this is problematic is that the managers who are the manager parts of self, they're trying to keep you safe, trying to keep you out of danger, don't like to be powerless. They love control. And if you try to take their power away from them, they're going to get pissed off. So what happens is that with the IVs, it just plows in them almost instantaneously, makes them powerless. And so when people come back out of that experience, what a lot of times they have commented on is that they experience after the fact, sometime after maybe days, weeks, or even months, a backlash where a part of them gets angry all of a sudden, or they get really frustrated. It's a part of them that never agreed to this, wasn't on board with letting go of this power and this control, and felt like it was taken advantage of. So I've seen this happen a lot. This also can be a very expensive treatment. So on average, I mean, you're going to see prices all over the place, but generally speaking, I've never really seen IV treatment for the full protocol of the, typically it's 6 sessions. I've never seen it for less than $3,500. I've seen it easily to be as much as $5,000, and it can be even more than that. The other thing to note about this is what makes it so expensive is that doesn't include any therapy. That's literally going to like a hospital-like setting. Someone puts an IV in your arm and there's no therapy. There's no setting intention. Typically, there's no integration work afterwards. It's just basically a nurse setting up an IV and just like letting you go for a ride. I've heard that a lot. That's not always the case, but that can commonly be the case. And even the support that might be provided, it's not a therapist that you're familiar with. So that is going to have to be something separately done. The other thing with the therapy is that I also recommend to clients to work with a therapist that's actually done ketamine, so they actually know what the experience is like. All right, so that's the first method. The second method we're going to talk about is intramuscular, the shot in the arm, essentially. So the pro is, again, just like IV, it's extremely powerful. It will break through almost all barriers or resistance and get you right into that dissociative state, which is where we want to get to. It's 95% bioavailable. So if you took, just for my gorilla math, 100 milligrams of ketamine, you're going to get 95 milligrams in your body. It's pretty specific, pretty accurate. It's also has the option to do split dose, so it can kind of take the extremeness off, like kind of level it out, so there's more level. It's not so much of a spike. So some of the cons with this is that it still is very fast. It's 3 to 5 minutes, and I mean, like 3 minutes, you're gone. Like it's not like 3 minutes, and I kind of feel something in 2 minutes. Like I think I might be there. Like you're like taking off like the Condor airplane. So it's or the Concorde airplane. So it can still have the issue of triggering the manager parts because because it's so powerful, because there's no buy-in, because there's no letting go, easing in. It's kind of just ripping power out of your manager parts of self. The split dose can also cause some grounding because essentially what it means is you're getting a shot to start you off, and about 15 minutes into the experience, they come in with another shot. So you have a needle going in your arm that can be grounding. So that's, pros and cons. I think ultimately, if you're going to do intramuscular, I would still do the split dose, but it is something to consider. And to, when you do feel it, just to let it go and not respond, not to get bogged down by it. This can also be expensive. It's usually not as expensive as the IV, but it's typically around 3,000. I don't know if I've ever heard anything less than 2,500. And it could be upwards of $3,500 to $4,000 I've heard. So it can still be very expensive service. And again, that does not include any therapy with an actual trained therapist in ketamine assisted psychotherapy. So that's the second method. The last method, and this is the method I use most with my clients. I do have for clients that need a little bit more of a push to get through some of the barriers where it's safe, is I do offer intramuscular, or IM, but most of my clients do sublingual, or they take what are called these pills called troches. They're just a dissolvable pill you put under your tongue. So the pro of this is a gentle takeoff. So it's less disruptive for the manager part. So I like to think of it as like a hot air balloon. It's going up, you're noticing it, it's continuing to take off. The thing about it is that it's just as strong at the height of it. So if you get the right amount of ketamine for a troche compared to IV or intramuscular, the takeoffs are much different. So there's a sense that the IV and the IM are more powerful, but at the peak for both the troches, IV, intramuscular, you have the same amount of ketamine in your system. It's just as strong. It just gets there a little bit slower, a little bit more gentler, so the body cannot, or the manager parts don't get freaked out and lock things down. It can be a lot, the ketamine itself is a lot cheaper. So you're talking about, for the ketamine itself, I mean, you're probably looking at maybe $100 for the whole entire protocol of 6 sessions. So it's very inexpensive, which allows for clients, in my opinion, to be able to get the psychotherapy as part of it and get a much better overall benefit out of it. The biggest con, quite honestly, is that for it's 18 to 22% on average bioavailable. So there's some variance to it, and it's a lower bioavailability. The solution to that is that you just do some simple math to back in. If you want 25 milligrams, if it's 20%, let's just say hypothetically for my gorilla math, then you just do 125 milligrams of troches. So it's not that hard to actually get it where you need to. There's a little bit more of a range. So sometimes you'll feel a little bit stronger of experience than others or lighter than others. And that's just part of the deal. That's one of the cons. So it's not exact. But again, keep in mind that the solution is not the chemical. And I think a lot of medical clinics have really gotten into overemphasizing ketamine as a treatment that fixes trauma, therefore getting the dosage absolutely dialed in and perfectly accurate is like the key to this. And it's just like any medical facility that they put too much emphasis on the chemicals and drugs and not enough emphasis on the underlying issues and reaching those. So to me, as a therapist, that's where I tend to focus more on, is really helping people in the process, guiding them through it. So what does the process actually look like? So we're going to talk about the environment, what it should be like. It should be comfortable. It should be quiet. It should be dark. Basically everything that's not in a medical clinic office. It should also provide, people should be going into this resource. So I have my client, they should be preparing for this mentally and emotionally, front loading information that will help them spiritually kind of let go and allow the experience to happen. So setting the intention is amazingly critical. Like this is probably the most important thing for a client to do. And most of the time when it's in a more of a clinical environment, they don't even know to do this, to set an actual intention. I also help with my clients, or it's important to have them front loading with like spiritual cards, resourcing, things of that nature. There should also be very specific type of support during and after the session. So during the session, the whole point of the person with the client is, first of all, to be there. I've heard of horror stories where clients get left in dark rooms and then they just leave and they're just reenacting the abandonment experience that we all probably on some level have. So it's just re-traumatizing the client. So don't do that. So first of all, the person should be there and they should have a grounded presence and energy to them. They also should have limited interaction or interference. So I've heard of stories where a nurse is taking blood pressure multiple times when the person's on ketamine. Now, I have my clients take their blood pressure right before, but I never do it during because it's grounding. It's going to bring them back into the earth and stop the dissociation, allowing them to go deeply into their inner being, which is the whole point. After the sessions, the support should be doing integration work only during the actual 6-session protocol. So we're not doing any kind of trauma-informed EMDR work. But once we get past the 6th session as part of my protocol, we get into trauma-informed bottom-up therapy that really helps people get into their body more, feel into the experience as a result of this KAP experience they've had, and utilizing like the EMDR protocol to start to process some of this trauma and use that 30-day window to really develop new pathways, strengthen them, and make this the new way of being. So again, the process with me is you're going to have a comfortable, quiet, and familiar environment because you most likely have been there before. I usually have a handful of sessions at a minimum, just to kind of get a lay of land and do an intake with my clients. And a lot of my clients are with me for months, even a year plus or so before they might do ketamine. So it's a comfortable, quiet, familiar environment. I do a lot with the intention. I have experienced firsthand how much of a difference this can make. And the intention that I help guide my clients to is an intention that is about feeling the experience, allowing things to exist and unfold, letting go of control, letting go of fixing, letting go of the egoic self, and just be in the moment. When I allow if I were to allow my clients to pick their own intention, most likely, most of them will pick an intention to fix my anxiety, fix my depression, fix my health issues, fix. And the reality is that that is an egoic intention. And the part of the mind that set that intention is going to hold on to see if it worked. And when they don't feel as if it's going to fix this problem, they will kind of rebel. That part of them will rebel and say, it didn't work. I'm broken. So setting the right intention is really important because it's all about letting go of this egoic self, not only in the ketamine experience, although that's really important too, but even outside of it, to let go of this egoic self that's constantly trying to be our protector, but is taking us away from our inner being, taking us away from a sense of being connected to a deeper self and connected to oneness, which is what is causing things to be traumatizing in the first place. So having an intention that encourages people to let go and feel the experience is really important. I also help them with front loading with spiritual cards. So they pick from like Native American medicine cards, geometric shape cards, and archetype cards, so they can actually get some kind of insight that somehow is going to help them in the experience, but also with the integration afterwards. I also have my clients listen to psychedelic music that is very helpful in feeling the experience. The music is really a vibrational sound that actually vibrates through their inner being when they're on the ketamine that they can feel into much more deeply. And that can actually bring about a lot of healing just from the feeling and bringing them into their body through the music. The support during the session, I'm grounded, I'm holding space, I'm right there, I'm present, I'm doing breath work, I'm doing my own work to stay rooted in myself, to have that energy be put out into this space. I also have limited interaction or interference with my clients. We have a we agree upon some signal that says, I'm in help, and I need you around me, which honestly, I've never had a client need that, but we always said it. So if they put their arms up and if that's not the signal, which I always tell them, don't do that because you probably will, I just let them go because I don't know what's going on inside of their mind. And I might ground them out of a very powerful, wonderful experience. After they come out, I'll help them dictate and kind of guide them through processing a little bit of what they experience, but always letting go of trying to make too much meaning and just notice and keeping them checking in with their inner being, their body, their inner space as they're talking and verbalizing some of the things that happened. The support afterwards. So at the beginning of each session, so before they've done the academy, we'll do more integration work from the previous KAP experience, KAP session. And that's really the bulk of it. We're not doing any heavy duty, let's dig deep and reprocess. We're just noticing and guiding them through the process and noticing even deeper. Once they're done with the protocol, which for me is 6 sessions, 6 2-hour sessions, typically over 2 to 3 weeks. And we keep them 2 to 3 weeks because if you do them longer than that, like 1 a week even, the problem with it is that the momentum that you build from the previous sessions kind of started to wane, and it's like pushing a rock up a hill. It kind of starts to roll back. And so the next session, you're just gaining back some of the ground that you lost. So you want to keep the sessions anywhere from 2 to 3 weeks, doing longer. A lot of people, some comment they like it because they can think more about it, but that thinking is actually getting in the way. It's actually creating egoic structure on it that then just has to be demolished in the next session. So even though it might be fun or appealing to people, the reality is it's actually counterintuitive or counterproductive, I should say. So we keep the sessions 6 sessions over 2 to 3 weeks. So 2 to 3 sessions a week is what our goal is. If we have to do, 1 a week here and there, it's fine. It's just, I try to keep it 2 to 3 sessions a week. Once we're done with the 6-session protocol, then that 30 days, we really dive into, we have a strategy in place to go into that deeper trauma that the person is struggling with and to hold space through the EMDR protocol. So we're really helping them go into their body deeply, experience their inner self, and then associate that with their life situation that had some traumatic events with. So what are the benefits of ketamine overall? So it gives a longer fuse, essentially. So people are going to temporarily feel calmer. They're going to feel more resourceful. They'll have more of a positive mindset. They might even notice that oceanic feeling of compassion from within. Here's the problem again. As I mentioned earlier, these benefits, the reason why I say temporary relief is because the ketamine molecule will recreate the environment in the brain for about 30 days. After that, what's going to happen is they're going to go back to atrophying again. And all of a sudden, their well-manicured house and yard is going to look like that house in the bottom there. It's going to start to grow back and go back to the way it was before. So ketamine, again, opens a window of opportunity, but it does not fix the problem. And if the provider that you're looking at or referring to does not understand that, then they won't know how to address it. So this is really important. So the benefits of ketamine-assisted psychotherapy, and I underline psychotherapy because it's in the name. It's not KAP if there's no therapist and it's not integrated. So the benefits are exactly the same. They're temporary and they're temporary, but they can be permanent because through the work of the therapy and the deeper healing, we start to actually discover that we are actually that oceanic feeling. That is the source of who we are. And we have, through building those neural pathways, we have a fundamental paradigm shift of how we see ourselves and the world around us. It also can help with those neural pathways in reducing the brain cell atrophy through doing that deeper healing, because we're using compassion, we're using that felt sense, we're changing the way we interact with ourselves and the world around us, which is opening up and maintaining those neural pathways in our mind. And again, the ketamine is going to open up that window it's about doing that deeper healing in order to resolve the trauma and to build a new identity of who you are that isn't the egoic self, a sense of that you are more than just your egoic self. And ketamine assisted psychotherapy can be one of the most powerful and helpful ways to even experience it, to know that it even exists, this deeper, greater version of you, and then allow you an opportunity to actually build a connection with that inner feeling, which is what a secure attachment is. See, a secure attachment is attaching to your inner self, your inner core, and ketamine assisted psychotherapy can open up that door for you. So here's my information. Please feel free, probably email is the best. Although the phone number on this screen, you can actually text. It's a Google number as well as HIPAA compliant. So feel free to text that number. But I'd love to hear from you. I'd love to answer any questions I didn't address in this video and see how we can potentially work together. So I also offer 15-minute free phone consultations to any prospective client. So if you're a healthcare provider, if you have someone who might be interested, just have them reach out to me, or you can reach out to me if you have an ROI, and we can certainly coordinate a free phone consultation. If you're an individual looking for help, again, just send me an email saying I'm interested in looking at having a phone conversation, and I'll set up a time with you. So I look forward to hearing from you guys. I hope this was helpful, and you have yourself a great day.